We always hear about vitamin D. Call it the sunshine vitamin, right? But what if I told you that for a ton of people, there's a serious shadow hanging over that sunshine? We're talking about a deficiency that can have a huge impact on your health, and you might not even realize you have it. So I've got to ask you directly, are you getting enough? Because it turns out this is a way more common problem than you'd think, even for people who live in sunny places. We're about to dive into what a deficiency really means and how you can spot the signs. All right, so what is the big deal with vitamin D anyway? I mean, sure, we all know it's important for our bones, and that's absolutely true. It's critical for absorbing calcium, but its job is so much bigger than that. Think of it as a master regulator for your entire body, your nervous system, your muscles, even how your immune system responds. Without enough of it, these systems just can't work the way they're supposed to. The really tricky part about a vitamin D deficiency, the symptoms are super subtle. We're talking about things like vague muscle aches, feeling tired all the time, maybe even your mood feels a little off. It is so easy to just blame these things on stress or a busy life, when they could actually be your body's way of telling you something's wrong. So if the symptoms are so sneaky, how do doctors actually figure out what's going on? Well, it all comes down to the numbers and really understanding what those numbers mean for your health. Okay, so your vitamin D status is measured in something called nanomoles per liter. But you know what? Don't worry about the technical term. Just picture a traffic light for your health. It's that simple. If your level is below 25, that's a red light. You are officially deficient. Between 25 and 50 is the yellow, caution zone. You're considered insufficient. And the goal, where you want to be, is in the green, a level above 50, which is considered sufficient for good health. Okay, so who's most likely to end up in that red or yellow zone? Let's break down the groups that health experts are really keeping an eye on. And you might be surprised by how diverse the risk factors are. It's really not just about how much sun you get. For instance, as we get older, our skin just isn't as good at making vitamin D. If you have a darker skin tone, the melanin in your skin acts like a natural sunblock, so you actually need more sun to make the same amount. And then there are things like obesity or certain gut issues that can stop your body from absorbing or using the vitamin D it does get. So if you're ticking some of those boxes in the high-risk categories, should you just run out and demand a test? Well, the official medical advice is actually pretty specific on this point. Here's the main takeaway, and it's a big one. Doctors are all about treating the symptoms. So if you've got real bone pain or obvious muscle weakness, yeah, a test makes total sense to confirm what's going on. But, and this is important, if you're in a high-risk group but you feel fine, the advice is actually pretty simple. Don't even wait for a test. Just start taking a daily supplement, because the preventative step is going to be the same either way. Now, when a test is needed, it's super straightforward. It's just a simple blood test that measures your serum 25-OHD. That's the thing that gives you the specific number that tells you if you're in the red, yellow, or green zone we just talked about. Right, so let's say the test comes back and your levels are low. Now what? Well, the path to getting better is a really clear two-step process. It's all designed to get you back into that green zone safely and, just as importantly, effectively. The very first step is what's called a loading regimen. And the goal is simple. Quickly get your body's vitamin D stores back up to where they should be. This usually involves a grand total of about 300,000 international units, or IUs. Now, that number sounds absolutely massive, right? But don't worry, you're not taking it all at once. It's carefully divided up over several weeks. So here's how that actually breaks down in practice. Step 1 is that high-dose loading phase. A pretty common way to do this is taking a 50,000 IU dose just once a week for about 6 weeks. Then, once that's done and your levels are back up, you switch over to step 2, a much smaller daily maintenance dose to make sure you stay in that healthy range for good. Because really, once you've corrected your levels, the real work begins. The goal is to keep them there. This is all about building sustainable habits that will keep you and your bones strong for the long haul. So, how do you stay in that sweet green zone for good? I like to think of it as a 3-part toolkit. Using the sun smartly, picking the right foods, and for most of us, using a simple daily supplement to fill in any gaps. First up, the sun. And look, we're not talking about baking on a beach for hours. The advice is actually for short, regular bits of sun. Think 10 to 20 minutes on bare skin like your arms and legs, just a few times a week during the summer. The absolute key, of course, is to do this safely and never let yourself burn. Your diet can definitely help out too. The best natural sources are things like oily fish, red meat, and egg yolks. But I gotta be honest, it's incredibly tough to get all the vitamin D you need just from food. That's why it's always a good idea to check labels for fortified foods like cereals or spreads that have extra vitamin D added in. And that's the reality for most of us, especially if you live somewhere with real winters. Your diet and the summer sun, it's just not going to be enough to last the whole year. And that's exactly why many health organizations now recommend a super simple preventative step, a daily 400 IU supplement, particularly during the fall and winter, just to make sure your levels don't dip too low. When it comes right down to it, especially with sun exposure, this one little phrase from the experts really says it all. Little and often is best. It's not about one big, intense dose. It's about building a consistent, safe routine. So there you have it, the full story of the sunshine vitamin and its shadow. It's a powerful reminder, isn't it, that sometimes the most basic things for our health are the easiest ones to forget about. We've talked about the sneaky symptoms, the simple diagnosis, and the clear path to staying well, which really only leaves one final question for you. For your health, for your bones, is it time for you to step back into the sun?